Monkeypox cases are now confirmed in more than 70 countries. The WHO's top monkeypox expert says 99% of all the cases outside of Africa were in men. Well, let's go in depth on how this health emergency is being handled here in the U.S. Joining me now from St. Louis, Missouri is Lauren Weber. She's the Midwest correspondent from our partners at Kaiser Health News. Lauren, thanks for being with us.
Thanks for having me.
Yeah, first up here, sexual health clinics are on the front line of trying to contain the monkeypox outbreak, but it's a struggle. Talk to us as to why.
Well, I want to be clear from the start in that monkeypox is not considered a sexually transmitted infection, but it is spread by close contact and is currently being spread among networks of men having sex with men. And oftentimes, some of its symptoms can resemble other STIs. And people prefer to go to sexual health clinics as opposed to their doctor because there's some anonymity in that and they feel more comfortable. The problem is that the sexual health clinic network in the United States is completely underfunded and ill-equipped to kind of see this rise of patients alongside the other STIs that it's currently battling. You know, in general, STI prevention in the United States, the funding for that has dropped 41% if you account for inflation since 2003. And, you know, the clinic staff that we talked to said they couldn't fit everyone in. They didn't have enough staff to see everyone. They had nurses cleaning the rooms because they didn't have enough staff to deal with it. And so they're very much stretched thin as this new challenge rises to their doorstep.
Yeah, and health data reporting has also been an issue. You found that some health workers are still using fax machines to report monkeypox cases in states like Florida and Missouri. Why is that? Who has a fax machine?
You would think in the year
days?
2022 that wouldn't be happening anymore. But it really brings us back to the early days of COVID, where similar things were happening. COVID cases were being reported by fax. And the reality is that as much contract money has been poured into the COVID response, the actual investment in permanent public health infrastructure upgrades has not come through. And so you still see the surveillance systems that are incredibly outdated being put to use across the country to fight this latest threat. And that means fax machines.
Well, what next steps would we like to see the U.S. take to try to contain this disease?
Well, you know, as Ashish Jha was pointing out, I think there's a real need for more testing. The more testing, the better sense you have of the outbreak, the better sense you have if there is access to the vaccine of potentially preventing more of the outbreak. So absolutely more vaccine rollout, absolutely more testing, more outreach, more community gathering, and more reaching the people that actually are affected. Right now, there's a lot of concern among experts that there's widespread spread of this that is not being detected in any way, shape, or form in the country. And so getting a better handle on it would definitely be a good start.
Right, because some people are getting the first vaccine, but getting the second one is also a challenge. We're just behind in this overall. Lauren Weber, we appreciate you joining us tonight. Thank you.
Thanks for having me.